I'm Dr. Jim. Recently, I did a video about acid reflux. I was asked about hiccups, presumably because acid reflux is one of the possible causes of hiccups, and because one of the characters in Grey's Anatomy died because of complications related to treatment of hiccups. The Mayo Clinic website has a nice discussion of hiccups, and I will summarize that. Hiccups can be defined as involuntary contractions of the diaphragm. Each contraction is followed by a characteristic hic sound. Hiccups can sometimes be accompanied by a slight tightening in the chest, abdomen, or throat. Hiccups usually are self-limited, but they may be chronic. They may cause problems with eating, sleeping, or breathing. Hiccups can be divided into those that last less than 48 hours or those that last more than 48 hours. The first group includes drinking carbonated beverages, drinking too much alcohol, eating too much, excitement or emotional stress, sudden temperature changes, or swallowing air. Hiccups that last more than 48 hours may be caused by a variety of factors. These include nerve damage or irritation to the vagus or phrenic nerve, which supplies the diaphragm. Examples which work by this mechanism include irritation of the eardrum, a tumor or a cyst in the neck, gastroesophageal reflux, sore throat, or laryngitis. A tumor or infection of the central nervous system is the next category. Examples of this include encephalitis, meningitis, multiple sclerosis, stroke, traumatic brain injury, and tumors. Metabolic disorders and drugs are other causes of chronic hiccups. Examples of these include alcoholism, anesthesia, barbiturates, diabetes, electrolyte imbalances, kidney diseases, steroids, and tranquilizers. Thank you.